As Hong Kong deals with a fifth wave of COVID-19 cases, what's the rationale behind its no lockdown strategy? Why hasn't the Chinese Special Administrative Region's zero COVID policy been as effective as on the mainland? And we also look at the Ukraine situation as Russia announced a partial troop pullout. Has the crisis been diffused? Welcome to The Point, an opinion show coming to you live from Beijing. I'm Li Xin. As Hong Kong battles a fifth wave of COVID-19 infections, the authorities have stepped up preventative measures. Carrie Leung, chief executive of the Special Administrative Region, said a citywide lockdown is not being considered right now. So what caused the surge in new infections? How does Hong Kong's zero COVID strategy measure against the let-it-rip approach? And how is the Chinese mainland prioritizing assistance for the city? In this exclusive, I will talk to Dr Gabrielle Leung, Dean of Medicine at the University of Hong Kong, who is joining me from Hong Kong. He is also founding co-director of Hong Kong University's World Health Organization Collaborating Center for Infectious Disease Epidemiology and Control. Dr. Leung, good morning and welcome to The Point. So according to official data from Hong Kong, the number of daily new cases started to rise at the beginning of February. Then they soared over the past week to reach almost 2,100 daily on Monday. That's double the number from last week. So how serious is the situation, and do we know what exactly caused this latest round of upsurge?
Good morning, Xin. Thank you for asking me to be on the program. It is very clear to us that the original importation came from inbound travelers into Hong Kong and through particularly a cluster in one of the designated quarantine hotels. This was in January, and it has then grown to the extent today. I think we're looking at an epidemic doubling time, that is the number of incident cases every day, of somewhere between 4 to 9 days. And that's really what we are looking at in terms of exponential epidemic growth of this Omicron BA2 strain.
Now, data from the Hong Kong Hospital Authority indicate that 90% of local hospital beds for COVID-19 patients are occupied and isolation facilities are nearly full. So according to your knowledge, how is Hong Kong's medical authorities or medical capacity coping with the situation in terms of medical resources?
Surge capacity is a real issue currently. So what the authorities are doing is to reprioritize who should be and need to be in hospital versus those, which is, of course, the majority, who do not need actual medical care, but just isolation from the rest of the community. So they are in that process and have been in that process in the last week. And I am fairly confident that they should be able to reprioritize and sort out care for those who really need them, particularly the older population, as well as the institutionalized elderly, as well as the very young.
Now, China's central government authority have said that they will take all measures necessary to help Hong Kong contain the surge. The main concern is boosting medical resources, especially testing capacity. And a meeting has taken place between the two sides, at least one. And the team and different teams, work teams, have been set up to coordinate action. So, what kind of medical assistance is being provided from neighboring places to Hong Kong? And what do you think of the support so far?
I think that it's extremely useful for the central government to have invited the Guangdong authorities to come over to the Special Administrative Region of Hong Kong to help with a few bottlenecks. One is testing surge capacity, and that is through making sure that we have sufficient lab processing power to deal with the number of tests that have skyrocketed, of course. And secondly, is to help with the construction of isolation facilities, while in the meantime, the Hong Kong authorities are identifying other hotel facilities, as well as other large-scale stadium to set up what in the mainland are called the Fangchang hospitals.
Right, we are looking at images of these. However, Hong Kong SAR Chief Executive Carrie Leung said on Tuesday that there are no plans for a citywide lockdown, which has been effective on the mainland in terms of controlling the infections very quickly. You have strongly recommended a lockdown for as long as 3 months to reduce mortality. What do you think are the considerations for the Hong Kong administration not to impose a lockdown, at least for now?
Well, I shouldn't wish to second guess the administration. They need all the support that they can get right now. But if you look at the simple maths of it, and we do mathematical models to look at what some of the public health and social measures could or could not do, what is very clear is that the basic reproductive number, that is how quickly this Omicron BA2 strain spreads, is at least 3 times as quickly as the ancestral strains, which are all that Hong Kong has ever dealt with. We have actually skipped over Beta as well as Delta. So what we need to do is to have social distancing measures that are more than 3 times as strong and as intense if we want to bring it back down to 0. And that is why what we need to do is to flatten that curve and to buy us some time so that the testing as well as critically, the isolation facilities are there in order for us to be pursuing the dynamic zero COVID policy.
Do you think the right measures are being taken at this moment without a lockdown to flatten the numbers to eventually bring the number of cases to close to 0 as much as possible?
Well, I don't really like to use jargons like lockdowns. What I really think is whatever we've been doing so far is probably not enough to bring down that incidence growth curve sufficiently quickly. So what we really need to do is to make sure that people mixing with each other and moving about in terms of population mobility, those things need to come right down. And we're not there yet. And unless we really reduce mixing and people moving around, we're not going to be able to bring down that growing curve so that we have a little bit of breathing space to have the surge capacities and testing and isolation facilities ready.
Do you think the kind of public sentiment is there, or are the general public ready and the authorities ready to cooperate, to work with each other to achieve what you just mentioned, more stricter measures without...
So a lot of people are, to the extent possible, working from home. All classes have been suspended or moved online. So quite a lot is already being done, but I don't think it's sufficient yet to bring that curve with that bend that we really need. And secondly, I think critically, what many people don't realize is that in Hong Kong, our older folks are not really sufficiently vaccinated. So if you look at the 60-plus age group, 56% of them have had 2 shots, the sort of full schedule. If you look at the 70-plus age group, only 43% have had 2 shots. And then if you look at the 80-plus age group, that's not even a quarter. And if you look at our nursing homes, those places is less than 20% 2 shots. So that's where we're very vulnerable. And that's the difference in our models between having 100 deaths to 1,000 deaths, which is the base case, and as many as 6,000 or 7,000 if this really spirals out of control completely.
The new wave is said to have caused doubts and dissatisfaction among some over the zero COVID or dynamic zero COVID strategy, which means, you don't actually have the number 0, but you try to keep it down as much as possible and you do everything that you can. Help us understand exactly why this did not work as well in Hong Kong as on the mainland.
I think it's because the infrastructure of Hong Kong is very different. So, for example, in Hong Kong, our vaccination rates are not nearly as high as many places in the mainland. Number 2, we are even more densely populated than many mainland cities. Number 3, I think it's because we haven't got the social organizations and those networks that the mainland has, which has so far been very useful in pursuing that dynamic zero COVID policy. And so it's really very different contexts. And I think that, with the central government's help and the Guangdong government's help, the Hong Kong government and the Hong Kong authorities will try their very best to bring this fifth wave down as quickly as possible and to minimize, of course, the number of severe cases and particularly deaths.
Yeah, Carrie Lam has called the zero COVID policy still the best strategy for Hong Kong. Help us understand your perspective on whether it is feasible to have the kind of living with virus approach that's practiced by many other places, or some other people call it let it rip, meaning, we don't impose we don't try to bring it down to zero. We kind of live with it. What is your thought on that?
I think that the unique context of Hong Kong is twofold. On the medical side, we are very different from most, if not all, other places that have so-called lived with the virus, because of our elderly vaccination coverage is much lower than many or not all of those places. Secondly, it's also because of our human as well as goods flow with the mainland. The mainland is our largest trading partner. It is still the #1 place where we get our food. 95% of our food comes from the mainland. So that open border with the mainland, quarantine-free, is something that is critical to Hong Kong. And therefore, when you have that kind of link, you need to have uniform sort of strategy and policies. So those are the two reasons. But the second one is actually in the distant future, because there is not going to be any kind of reopening of the border quarantine-free unless and until it truly reaches the same on this side of the border as well as the other.
What is your prediction for the near future, for the development of the numbers?
The numbers are going to go higher and higher still. We are nowhere near the peak of it. And I think that if you look at our model, we're saying probably the middle to the end of March would be round about where the turning point will be. But this wave is not going to go away for the next month or two.
All right. All the very best to our sisters and brothers in Hong Kong. Many thanks to Dr. Gabrielle Leung, Dean of Medicine from the University of Hong Kong.